Let's take a moment to see how this came along. It's December of 2019, and China announced the existence of a coronavirus that they've never seen before. It was new, novel even, and that's what we called it, the novel coronavirus. Fast forward to January, and we went from a problem within China to a problem within regional countries. It went around like that simulation game, Plague Inc., which China actually banned because of the whole hysteria. It was fine, relatively. Couple here, couple there. We still didn't know a lot about the virus, but we had conquered what seemed like similar viruses before. So we got this, right? Well, the virus continued to spread, and this spread wasn't linear, it was exponential. So what's different about this novel coronavirus? Well, the big thing happened when we got the clear idea of the breakdown of deaths. Fast forward a bit, and by now, a couple countries took measures. Some even shut down. Quarantine was mandatory. You couldn't go to work or even get a haircut. And, I mean, what was Zoom anyway? There were changes. And by March of 2020, these changes came quick. People were ordered to stay at home. And in front of it all, health services desperately needed to step up to the challenge. We needed a strategy. Fast. Given limited resources, we needed to be smart and the economics needed to be sound. It wasn't possible or affordable to test everyone on the planet. So based on what we learned on other outbreaks in the past, countries came up with a 3-point approach. Let's talk about that. Controlling movement was exactly how we already said. Closing borders so that people can't come in. And if not closing borders, being strategic about who was coming in and where they were coming from was the alternative. Controlling movement also meant asking people to stay at home so that they wouldn't have to spread the novel coronavirus, or that they wouldn't be at risk to get it from others. The most affected by far was air travel. Cruises took a bit longer and it was complicated. But we eventually got through it. Communication is extremely critical because people need to be informed about what was going on, as well as to know how to deal with it. I mean, governments just asked everyone to stay at home and stop doing what we normally do. That is, socialize. That's a tall ask even when it comes to a situation that has to do with the novel coronavirus. And so, education was necessary to communicate and address all these concerns. We had to explain why it wasn't the same as the flu, how to wash your hands, what and how to do social distancing. There was and is a lot to unpack. And this was to ensure that the healthy stayed, well, healthy. For those with the virus, however, that's the tricky one. As I said before, not everybody could have been tested. And actually, widespread testing like that wouldn't have been wise either. I'll give 2 reasons why. A test is only good for the moment in time in which that test is conducted, amongst other factors. You might be negative today, but it doesn't mean you can't be positive in the future. That false sense of security is something that we have to avoid. Testing in such a large quantity of people for a virus that could be spread by small air droplets from your lungs isn't the best option. I mean, with groupings and crowds at testing facilities, it could do more harm than good, and we could have healthy people actually get infected. Therefore, governments had to be strategic about who to test, and the best way to do that was by contact tracing and quarantine. Contact tracing is the identification of suspected cases from confirmed cases. Let me break it down to say why this is a key public health strategy. In order for the novel coronavirus to be a problem in any particular country, it had to come in from the outside, be it by land, air, or sea. These confirmed cases from the outside are known as imported cases, and they don't stay by themselves. They interact with others, be it the taxi driver from the airport, or even their families back at home. We suspect all of them to be possible cases, and so we examine them. These are primary contacts. Of these primary contacts, we also have to think about who they have interacted with and who they could have possibly infected. These are the secondary contacts, and people they interact with are tertiary, and so on and so forth. This is contact tracing, and the earlier you do it, the less the number of people you'll naturally have to trace. It's a lot of work, but there are big benefits, and they have to do with the early identification of cases. It ensures that the disease spread is limited, so therefore, you're protecting the healthy and the high risk. It also means a better outcome for those confirmed cases. This is to say that they recover sooner, because they will be receiving treatment while the condition is relatively mild. As you can imagine, quarantine and isolation involves separating the suspected and confirmed cases from the healthy population. Nobody could get sick if they're not exposed. All of this together has been part of the general strategy that countries have been using to deal with the novel coronavirus. Actually, it's a strategy that's been working out for us. If you want more information on that, you could check a link to another video that I would put over here. I want to take this opportunity to thank everyone who brought us to this point. And this strategy will work well for the future. The best strategy to eradicate this virus, the best outcome, is to get a vaccine. Comment down below if a video on vaccines is something that you want, or any other suggestions for that matter. Till next time, my name is Alphonsus. Follow me on social media, and if you haven't subscribed to my YouTube channel, do it already. Thanks for watching.